guest, Professor Takoko Izumi from APRU and Erai Tohoku University, Honorable Dr. Animes Kama, Kuma, UNDRR Regional Office for Asia and the Pacific, Honorable Dr. Alexander Hamilton. Welcome from CBR and Southeast Asia, and Honorable Mr. Robert Herianto Tamangor, CBR and Indonesia. Respected guests, ladies and gentlemen, and also I would like to congratulate DRR University of Indonesia who succeed in running this webinar. It is my pleasure to deliver an opening remark for the online seminar, or we call webinar, New Approach for Disaster Risk Management after COVID-19. I think we are still in ongoing how we fighting the COVID-19. On behalf of Universitas Indonesia, I am expressing my deep appreciation to the APRU multi-hazard programs, the Disaster Risk Reduction Center Universitas Indonesia, CBR and NATEC Asian Disaster Risk Initiative for hosting these events. Nowadays, the global community are facing multidimensional challenge during this pandemic. COVID-19 has infected nearly 38 million, right now already achieved 38 million people throughout 214 countries and still counting. Hard choice have to be chosen, and prioritizing healthcare during the pandemic over economic policy to avoid recession in among many faceted. Prioritizing debate in many countries. And I believe that as part of the academic community, we must join our forces and resources to come together as global citizens to fight against COVID-19. This will be our noble contribution, not only for our respective nation, but also in the world and the human race. Universitas Indonesia has widely reputed as the main academic, intellectual, and innovative counterpart of Indonesian governments and a great contributor to nation fight against COVID-19. Among many achievements, our engineers have invented relative low-cost portable ventilator, what we call OVEN-20. Our economic, social, and political scientists have actively delivered policy recommendation to our governments, and also our pharmacists and medical doctors have done excellent research in new drug, treatment, and vaccine. And also, that will be very important, our hospital has served as referral hospital in testing and treatment for COVID-19 patients. Currently, enhancing international academic research and partnership has been one of our top priorities. This enables Universitas Indonesia to expand our spectrum in terms of its role as one of Indonesia's top and prestigious universities toward achieving world-class university. We strongly believe that both academic and research partnership may enhance the quality and quantity of the academic and research group among academicians and researchers and enable them to expose the current global trends. Therefore, we are committed to boosting our international and multidisciplinary research partnership. I think this is part of our effort how to increase our research international collaboration or our international partnership. Finally, I hope this program can serve as a platform to showcase the strength of partnership and bring together experts from various fields to achieve long-lasting and sustainable partnership, not only in this area of today's, and which is the area of disaster management strategies, but also in wider area. I wish you have a great discussion during this event, and I am looking forward to next webinar series. Terima kasih. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Professor Abdul Haris, for your warm welcome and opening remarks. I believe that Professor Abdul Haris will have another important activities, but please, before leaving our forum, let us make a group photo. So will you please all the participants Izumi Sensei, will you please
thank you.
turn off? Ya, tunggu Pak Haris, belum.
Thank you.
Ya, tunggu dulu Pak Haris. Sedikit, ya, foto dulu sebentar Pak.
Oke.
Silakan panitia di foto.
1, 2, 3. Oke, sudah cukup. Terima kasih.
Oke, terima kasih Pak Haris. Thank you so much Pak Haris.
Thank you. Bye-bye.
Thank you. Ladies and gentlemen, now we are proceed to our first speaker this morning. Before I introduce our first speaker, I will give you a bit explanation about our activity or webinar this morning. So the background is because we have a COVID-19 pandemic, and this pandemic reminds us that disaster risks are not only natural, but also include different types of disasters such as biological, chemical, industrial, and in this case, we have disease as disaster. So it is crucial to understand these various types of hazard risk and take proper preparedness measures to ensure effective response effort. This webinar series consists of 3 sessions. The first session already done, and then the topic is understanding and addressing different types of hazard risk. Today's topic is strengthening disaster management strategies through multi-stakeholder partnerships. And then after today's webinar, we will have the third topics with the third session with the topic of developing innovative tools and approaches for disaster preparedness and response. The webinar series organized by the APRU Multi-Hazard Program, the University of Indonesia, the CBR NATEC Asian Disaster Risk Initiative. Today, we will have 4 speakers. First, Professor Takako Izumi, and then Dr. Animes Kumar, and then Dr. Alexander Hamilton, and Mr. Major Robert Ariando Tumangor. So we will have now the first speaker. Every speaker will have about 15 minutes of presentation, and then it will be followed by about 9 to 10 minutes of question and answer discussion. Professor Takako Izumi is an associate professor at the Tohoku University International Research Institute of Disaster Science, working on global framework and strategies for disaster risk reduction. She concurrently serving as director of the APRU Multi-Hazard Program that aims in addressing the threat and frequent natural disaster in the Pacific Rim. Before joining Tohoku University, she spent more than 15 years working in the fields of disaster risk reduction, response, recovery, and development of MERSI Malaysia, UN Habitat, UN Office for the Coordination of Humanitarian Affairs, UN Office of the Recovery Coordinator for Aceh and Nias, and UN Office for Disaster Risk Reduction. In 2015, she was appointed to the UN Disaster Risk Reduction Asia and Pacific Science Technology Academia Advisory Group to support the efforts of governments and stakeholders in the implementation of the Sendai Framework for Disaster Risk Reduction. She holds PhD in Global Environmental Study from Kyoto University, Japan. Professor Izumi, you have 15 minutes for presentation. Time is yours.
Thank you very much, Professor Kusumayati, for your introduction in this webinar series, and also myself. I'm Takako Izumi. Hello, everyone, and from the International Research Institute of Disaster Science, IRIDIS, Tohoku University in Japan. And also, I'd like to thank Professor Fatuma and her team and University of Indonesia for hosting today's session. So today I'd like to speak about partnership with multi-stakeholders and role of university. So as Professor Kusumayati explained, this webinar series consists of 3 sessions, and today's is the second. So firstly, I'd like to share some points discussed very briefly at the first session of this webinar series that was held on 30th of September. And the overarching objective of this webinar series is that to understand the risk of various types of hazard risks and discuss preparedness measures to ensure effective response and effective response efforts towards all hazards. So that is the reason why this webinar invited speakers with different backgrounds and of different types of hazards, such as natural and CBRNE. And the first session held on 30th invited 3 speakers with a background of chemical, radiological, and CBRNE hazards. And regarding the chemical hazards, Professor Fatuma from University of Indonesia introduced a mitigation strategy called process safety management. And that includes 20 elements required to ensure the safety environment. And also a number of innovative tools and equipment and advanced technology already exist to reduce the risks. Therefore, it is also important to learn these existing tools and apply to improve the current status. And for nuclear and radiological hazards, Mr. Martin Mayer from the IFRC shared his experience and knowledge, as well as case studies of nuclear accidents in the past. And IFRC, together with Red Cross and Red Crescent societies, national societies, has been working intensively to communities to communicate the hazard risks to communities and even at schools to raise their awareness on disaster risks. And for CBRNE, Mr. Jeff Walker from JKG Consulting stressed the importance of the approach, all agency approach. And CBRNE are always unpredictable, so easy to cause an intense reaction. To avoid that, it is crucial to understand the risks and the role of each agencies and organizations with a clear incident command system. These are the main and very important points addressed by the speakers at the first session. So this first session you can access on the YouTube with the link on the slide. And also another point addressed and highlighted was the definition of hazards. So currently there are several materials who already clearly stated the definition of different hazards. So first of all, I'm sure most of you already know about standard framework for disaster risk reduction. It's also emphasized this framework will apply to the risks caused not only the natural but also the man-made hazards, as well as related environmental, technological, and biological hazards and risks. Then another important report lately published is Hazard Definition and Classification Review. And this report included the list of 302 hazards. So you can also download this very important publication from online. And also IFRC Public Awareness, and they published the publication is called Public Awareness and Public Education for DR. And it addresses the needs for all hazards, households, and family disaster planning. And also the priorities include not only the natural hazards, but also the release of chemical, biological, radiological materials. And they emphasized the importance of sharing the risks of these hazards together with to the communities and also at schools. And the last document is that called Words into Action Guidelines, Implementation Guide for Man-Made and Technological Hazards. This is also issued by UNDRR, and it is clearly stated the definition of these two categories of hazards. And the things I really would like to highlight from this document Works into Action Guidelines is that the number of magnitude of man-made disasters has risen worldwide since the 1970s. And also there is a need to address man-made hazards by strengthening national and local disaster management plan to include these hazards and by raising awareness of their risks and impacts. So considering these very important points, that disasters is not only the natural, but also the different types of hazards as well. So since I'm from the higher educational institutions, universities, now I'd like to focus on the challenges on the campus in terms of disaster risk management. So the question is, why is it important for universities to consider the risks both of natural and man-made hazards? So simply because many of us have not realized the fact that HEIs keep various dangerous materials such as chemicals, discharge of gas, experiment waste leakage, etc. So once any accidents happen, it may threaten community safety, not only on campus. But still the HEIs and universities have a lot of challenges to overcome and also to achieve the campus safety. Some of the major issues include the office in charge of natural hazards and also the man-made incidents are different. And each department has their own manual and plan and hardly shared among these departments. And the information on the incidents occurred in each department are not shared unless it is a serious incident. And once a serious incident happened, that the chain of command is also not really clear. And manuals developed by each department has different contents. And for example, some more focus on preparedness and some more focus on how to manage dangerous chemicals and not mention about how to respond when emergency happens. So in order to strengthen the collaboration among universities itself and discuss the common challenges and learn from each other, the APRU Multi-Hazards Program initiated the Campus Safety Program in 2015. And it organizes a workshop every 2 years with the member universities. And APRU is Association Pacific Rim Universities, and currently, and we have 56 member universities from 18 economies in the Pacific Rim. So I appreciate the active participation of University of Indonesia also in this program activities since the beginning. So I'd like to introduce some of the achievement from the workshop, from the last workshop. So at the second workshop held in 2018, we discussed the minimum checklist of campus safety, and it consists of 6 areas. But the last one, academic continuity, was added at the workshop held this year, considering the COVID-19 pandemic. And you can see this checklist from the workshop report, which is available online as well. And you can see the link on the slide, and you can also download the report from this link. And these are some indicators included in the minimum preparedness checklist. And but this is just an example, and we spent quite a lot of time and consultation among the members at the workshop. And there were many elements we wanted to include, but this is a minimum checklist and should not be so demanding. So that's what we agreed, and we picked up some very basic and made it very simple. And we are currently conducting a survey among universities to see the progress and the status of preparedness on campus based on this checklist. So I hope we can share the result as a paper in the near future. So as I mentioned, we included the last part of academic continuity considering the experience after the COVID-19 pandemic. So if we consider other hazards, and we may need to include more elements from different perspectives. in order to improve this list, we also need inputs from experts of different types of hazards beyond the pandemic and also natural hazards, but rather we hope to discuss further about the chemical and also the new radiological and other types of hazards as well. And once again, the report of the Hazard Definition and Classification Review highlighted that the challenge is that most of traditional DRR networks do not have members from areas of different and broadened types of hazard, such as societal and biological or technological. So inclusion of experts on these less traditional hazards can be crucial. And I hope this webinar series provided a good opportunity to learn about the risks of different types of hazards and also to review the current management plan to make it more comprehensive and also applicable for our broadened types of hazards. And we also formed a group called CBRNE, NATIC Asian Disaster Risk Initiative, after this year's campus safety workshop as a discussion platform of risk management for various types of hazards with different stakeholders. So I look forward to further discussion on this matter through the networks as well. And I really encourage all of you to join us and also to continue discussing the risk and how to prepare for the broadened scope of hazards and hazard risks as well. So, and lastly, I also would like to share the information about the third session, and this is the last one in this webinar series. So the session 3 is the title is Developing Innovative Tools and Approaches for Disaster Preparedness and Response. So this session I hope this session will share the new tools and innovative approaches to overcome our current challenges tackled by different types of hazards. So they will be held on the 28th of October on Wednesday. So this is led by CBRNE NATIC Asian Disaster Risk Initiative. So I also look forward to your participation in the third series. So thank you very much for your attention, and I'm really happy to take your questions. Thank you.
Thank you, Professor Izumi. Now we have some time for discussion, for question and answer. For all participants, will you please write your question in the question and answer function, and then so that I can deliver your question to Professor Izumi. There is a question from Rodolfo Arias to Professor Izumi. The question is, are the definition of terms related to disaster risk management only in English? Are there official translation into different languages of the APRU members? Please, Professor Izumi. Yeah.
Okay. Thank you for the question. Unfortunately, we don't translate these materials from English to another languages under the APRU Multi-Hazards Program. Although we have members from different countries, but so far we don't have any translation support to other languages about these materials.
Okay, second question from Christina Schonleber. A question for Professor Izumi. How has, and in her opinion, about COVID-19 impacted on university disaster and hazard preparedness plan? What are new areas and activities universities have to consider?
Okay, thank you very much for the question. And of course, the COVID-19 pandemic made a lot of impact on universities and also the educational system. First of all, of course, we had to change our education and learning system to online. And that was challenging for both students and also the faculty members. And also not all the students and faculty members did not have internet access from home. And we were also prohibited to come to the office. So in that sense, it is quite difficult at the beginning to have the simply access to that kind of new mechanism and system, online system. But so far, I think things were quite progressed, and simply because we got used to it, and also most of the technological infrastructure was already installed. So in that sense, I think we are currently, things are quite going well. And now we realized this kind of online education is also good for everyone, and simply because we can reach out a wider audience, and we can communicate very easily people and students and the faculty members from all over the world. So that was a very good and positive side we learned from the online education system. And so new areas universities have to work on after COVID-19 is that the planning, again, most of the university did not include the preparedness beyond natural hazards. So now we have to also think about how we can prepare for a pandemic, and also not only the pandemic, but also the chemical and other types of hazards. As I mentioned, university have a lot of risks, to be honest, and chemical and also dangerous and materials, and also the gas. And once something serious happens, that impact is quite huge. So that's something we have to consider as a universities. And once again, we have to review our current management plan and to take a proper measure to strengthen that, I think.
Okay, thank you, Professor Izumi. A question from Mr. Rizky Jati Utomo. What is the most effective method to prevent COVID-19 with 12,000 workers on site? At this time, our company method by using site quarantine for the arrival outside regional that impacted.
I see. Thank you. That's a very difficult question to answer because the situation will be very different from country to country and also the region to region. And one thing we found very important is that also the personal preparedness. And currently in Japan, and we are very careful to have the masks everywhere, wherever we go. So that kind of personal preparedness is also very important before we think about the the entire preparedness measures at the different levels. But of course, the national and regional levels, there are so many things we can do. And as you mentioned, and the quarantine system is also one of them. It's also probably the very important. And from now on, we will have quite a lot of case studies, and we also try to collect some case studies from universities, how they responded and how they were effective. So I hope we can share this kind of case studies in the near future, and I hope you can also get some inputs and also some points you can probably apply for next event in the future for the at even the different levels. Thank you.
Okay, Professor. Another question from Ms. Junior Hanani Darundiati from the Environmental Health Department, Faculty of Public Health, Diponegoro University. The question is, how could my institution join the association, the APRU Association? What should we do?
Okay, thank you. So to join the APRU, and first thing you have to contact with the APRU Secretariat in Hong Kong, and you can check the contact address from the APRU website. And APRU Multi-Hazard, which is I'm leading, that program welcomes to the university who are very interested in the multi-hazards. So we organize summer school, for example, every year. So you can join that summer school, and also the annual symposium will be hosted by different universities in the region. So we can share the information of multi-hazards activities, and I hope you can join one of our multi-hazard programs activities in the future. Thank you.
Another question from Mr. Abdul Qadir. Who should involve in campus safety? Any tips to increase awareness of campus safety like in Japan? Because we have different culture here in Indonesia.
Yes, thank you. I'm sure we have, and each university has a different plan, management plan. And in universities, I mean, at the workshop, we discussed is that one of the important things is to include the top management in that, for example, evacuation drills and also that kind of very important meetings, because we need a lot of support to make sure the preparedness system on campus. We need financial support and also the human resources and technical knowledges. So that the challenges we cannot strengthen our campus safety is that these 3 points, they raised lack of financial support and lack of technical support, and also the lack of human resources. So if university can strengthen these 3 points to strengthen their campus safety, then I think there are so many things, and you can start and discuss about campus safety from that. And we are very happy to share whatever we have right now, like a report, and you can join us the workshop to be held every 2 years, and it's called Campus Safety Workshop as well. Thank you.
Next is a question from Mr. Rizaldi. The question is like this: which one is more priority, more to get a higher priority? Whether to enrich the nutrition of people or students during COVID-19 pandemic, or to lock down without having good nutrition. So what is your consideration to set the sequence of priority?
I'm sorry, I could not get the priorities. Can you repeat the priorities once again?
Yeah, comparing between 2 strategies. The first strategy is enriching the nutritional status of people or students, or by implementing lockdown without having good nutrition.
Oh, you mean nutrition?
Nutrition.
Okay, I think the first priority is that the students and will have enough nutrition before COVID-19. Is that, sorry, I really
yeah. Enriching the nutritional status of the students without locking down. The second strategy is doing locking down, but we do not intervene anything to improve nutritional status of the students.
I think that's a little bit difficult question to answer, and because first of all, the decision of locking down is also quite a tough decision for universities. So currently, unfortunately, I really do not have a very good suggestion on the priorities, which one is more important, and yeah.
Okay, I think because 2 approach, they are working at different level. Improving nutritional status is working at a health promotion level, while locking down is prevention level. So actually they are not replacing each other, but they should be complemented. That's my opinion. Because improving nutritional status is improving the health status. It is the health promotion, but locking down is preventing the transmission. So they are at different level. So actually we have to apply both. We cannot choose which one of those 2 strategies. Yes, okay, another question. I think this is also a very interesting questions. How can we consider sexual predators able to hack ongoing online classes? Can we consider it hazardous also?
Hacking the network, I mean, internet access during the classes.
Yes, yeah.
Yeah, could be in the cyber security is also probably quite a big issue in the modern society. So currently, fortunately, our university and also most of us have not maybe faced that kind of issue. But if we continue this kind of mode and educational mode, definitely that will be one of the things we have to consider and discuss, and probably the cyber security issues as well, as in one of the hazards probably.
Yeah. Another question, Professor Izumi. Is there any strategies to strengthen safety leadership for disaster preparedness for community at the community level?
Okay. The community levels, I think that there are so many organizations and already worked, and also the universities ourselves is also working to raise the public awareness and strengthen their preparedness capacity at schools. So currently there are so many activities ongoing at the local level to strengthen the community, the capacity of community preparedness. So in the region and probably the country, the major actors could be different. So still some countries and local government and national government are providing a good education and strategies for the communities. And like us, and the good thing is the community is the one who are taking the initiative by themselves for future disaster preparedness. Simply because we experienced so many disasters in the past in Japan. So the community itself have quite a lot of knowledge. So they try to pass on their knowledge into the next generation as well by themselves. So the kind of experience that maybe we can share each other, and they can think of what would be the best way for them to include for their the future disaster risk management as well.
Okay, Professor Izumi, I think this is going to be the last question for you because we have very limited time. It's very interesting questions. What can universities learn? This is from Gabriel Florendo. What can universities learn from exploring occupational safety and health standards and integrating them with current DRRM strategies of universities? Can you give one example from the Japanese DRRM experience?
Okay, so is that the DR, and you said explosion things? What was the another issue?
Exploring from what universities learn from exploring occupational safety and health standards,
okay,
and integrating them with current DRRM strategies of universities.
Okay, thank you so much. And what we are doing here is that we already had BCP on universities, on campus. So again, the different department has a different BCP. And considering the experience of this COVID-19, I think we modified and improved our current BCP, which more includes different types of hazards. So I think that was quite a good experiences for us. And currently we already recognize the importance to include the pandemic and biological hazards into our BCP. So that the first thing, I think definitely not only on campus and university, but rather it's important to review the current BCP and how much they can cover, what kind of disasters in the future they can cover it, and they already include in their management plan. But if not, definitely it's very important to consider to expand the current coverage in the BCP of universities and also the other private sector and other any organizations.
Okay. There are still another two questions from Rodolfo Arias and from Jin Sung Lai, but unfortunately we ran out of time. So if you don't mind, Professor Izumi, will you please open the question and answer function and then answer the questions by typing your answer on that function. So thank you so much, Professor Izumi, for your presentations, and also thank you to all audience for the questions and discussion during this so let's proceed to the second speaker. We will have Dr. Animesh Kumar. Dr. Animesh Kumar is the Deputy Chief of the United Nations Office for Disaster Risk Reduction, Regional Office for Asia and the Pacific, based in Bangkok. In this capacity, he coordinates disaster risk reduction policy and intergovernmental, multi-stakeholder, and UN mechanisms in the region. Before joining this position, Dr. Kumar held the same position in the UNDRR Regional Office for Africa, based in Nairobi. In his previous positions, Dr. Kumar worked in the other UN entities in Africa and Asia, including on a UN secondment to the government of Ethiopia as their policy advisor on DRR and climate change. Dr. Kumar has also led risk assessments and profiling in multiple countries, including a series of food security atlases in India, and serves on various committees, including on science and technology, urban and city resilience, business resilience, etc. Dr. Animesh Kumar is a geographer and holds a Master of Philosophy and philosophic doctor in adaptation and sustainability. Dr. Animesh Kumar, you have 15 minutes for your presentation.
Thanks a lot for that introduction. So while the presentation is put on the screen, let me take the opportunity to pass on the greetings to all the participants and the panelists on the occasion of the International Day for Disaster Risk Reduction that was observed globally yesterday. But we're actually having a series of events being organized the whole week, leading up to the World Tsunami Awareness Day, which will be on 5th of November. So in my presentation, what I would do is to bring in the issues of multi-stakeholder partnerships and how it is very important in terms of achieving the new paradigm of disaster risk reduction, which is a Sendai framework, and how we as a UN entity are doing it in our own way, engaging with multiple stakeholders. So let's move to the next slide to give a bit of a context. If you look at the disaster landscape in the region, in the last several years, I would look back at the last 3 decades. And why last 3 decades? I'll just come to it in the next slide. But we have seen 50% of disasters, 64% of mortality, and 90% of the affected population in Asia Pacific. During the same time, next slide, please, we have also seen a structured dialogue happening across the world in the last 30 years, starting with the International Decade for Natural Disaster Reduction in 1989. And all of us are aware of the Hyogo framework. And then in 2015, which we often call as the Year of Resilience, where a series of international agreements and frameworks were endorsed, including the Sendai framework, the 2030 Agenda, the Paris Agreement, and the next year, the Agenda for Humanity and the New Urban Agenda. So you see that a series of agreements being adopted within a duration of 16 months, 6 of them actually, gives us a very unique opportunity to talk about coherence and ensure that we cross-fertilize risk across different international frameworks. Next slide, please. So while these agreements were endorsed and we were implementing disaster risk reduction, what we have seen some very great advancements. The first is in context of what I mentioned, a very structured dialogue. These frameworks have provided a structure to ensure that we approach disaster risk management in a very cohesive way. The second is that all the governments in the world have acknowledged the importance of disaster risk management, in particular proactive disaster risk management, to ensure that they have dedicated government institutions, they have identified focal points to work with us. All of them now have some form of a guiding document, a policy, or a strategy, or a plan, in many cases legislation, to ensure that they have the right regulatory mechanism to implement. Of late, since 2015, we have also seen formalization of data. We have also seen expansion of new actors and stakeholders, something that I will focus on in this presentation, and a suite of tools being released that Takako-san also presented some of them in her presentation. The result of all of this has been that we have seen very high progress in governance mechanisms. We have also seen good progress in preparedness mechanism. If you look at the last 2 reports of the UN Secretary General on the Sendai framework implementation, we have calculated that there is a perceptible decline in mortality levels because of disasters resulting from most hazards. At the same time, while we have seen these great advancements in declining mortality, we have also seen very low progress in addressing the underlying cause of risk. So in this figure, you would see how we have progressed across different priorities of the Hyogo framework over a 10-year duration. The green line is areas like governance and preparedness, where we saw good achievement. And red line is essentially addressing the risk drivers, where we haven't made a lot of progress. Next slide, please. So the result of this is, as I mentioned, declining mortality, but economic losses have increased tremendously. In many of the cases, we have seen very high proportion of losses to the GDP in different countries. And also many of the people across the world, both in the mid-income countries, as well as the LDCs and SIDS, they are being pushed back into the poverty scales. Next slide, please. So this is a very interesting map, and as a geographer, I often tend to use maps for my illustration. This is a map which shows the development investments in a country measured through capital and social investments vis-a-vis the annual average losses that countries face because of disasters. The darker the shade of a country is, the more a country is losing of their development investment because of disaster losses. And this shows very well that how much are we losing, that while countries are trying to or striving to actually achieve the 2030 agenda for sustainable development, they're also losing a good proportion of their investments into development because of disaster losses. And this becomes more clarified if you look at the recently released SDG progress report in Asia Pacific, where we have seen that for specific disaster-related SDG targets, there is actually a reversal in Asia Pacific region where many countries are actually going backwards on SDG achievement. And this is only going to be further exacerbated, which we will see early next year because of COVID-19. Next slide, please. Let's talk about COVID for this slide. The blue part of the graph shows essentially the affected population because of disasters this year in Asia Pacific, and the green are those infected because of COVID. There is no correlation, there is no regression between the two, but essentially the graph shows that there is a substantial number of people who do get affected because of disasters, which often exceeds the number of people who get directly infected because of COVID. That does not take into account the socioeconomic impact of COVID. We already know that the socioeconomic impact of COVID is actually exceeding the health impact of COVID. But goes on to show that the resiliency level of people in the region as well as in the whole world is being affected because of this duality of COVID vis-a-vis other disasters that we are seeing. Next slide, please. So all of this points to the fact that while hazard is a very key component of disaster risk, it is not the only one. Unfortunately, majority of the risk assessments focus on hazard analysis. And this has had implications on the way we manage disaster risk, where most disaster risk reduction actions focus on reducing hazard or its mitigation. However, vulnerability is a big component as well, and it is increasingly being acknowledged that the differential impact of disasters is the differential vulnerabilities across time and space. We also now acknowledge that vulnerability itself is not a static concept, but varies, as I said, across time and space. The interplay between equity and inclusion often leads to a vicious disaster poverty nexus. And this becomes substantiated if we look at the recent ESCAP report on increasing inequalities in Asia Pacific. In Asia Pacific, the region's combined income inequality measured by the Gini coefficient, for example, has increased by over 5% point in the last 20 years. And this goes contrary to the rest of the world. For example, China has seen its income inequality soar by close to 10% points. Indonesia's income inequality has risen by around 8% points. And Bangladesh and India have also seen their income inequalities also increase by 5%. And this points to the fact that while we are talking about addressing vulnerability, there is also a growing gap among the more vulnerable and the less vulnerable. That brings us to the question of inclusion. Inclusion in context of decision-making, inclusion for program benefits, and often exacerbated by disasters. We have seen that disasters cause the near poor, those living in between $1.9 to $3 a day, to fall back into poverty. And then in case of children, we have seen increase in dropout rates, which lowers their employability and then has a life cycle impact on the children as they grow up. The issue of inclusion was also highlighted by the GNDR, the Global Network on Disaster Risk Reduction. It's a consortium of NGOs and civil society organizations. They have released a report a few days back, which talks that they have found that 16% of the people who feel only 16% of the people feel included in assessing threats, policies, and plans, and taking action to reduce the risk of disaster. So that goes on to show the level of exclusion we are seeing in program design and its implementation. Next slide, please. So All of this has forced us to question the way we manage and we assess risks. We can no longer use the past as a mirror of the future. And most importantly, which is the recent development, but has been talked about in research circles for several years, that risk cannot be compartmentalized. We need to talk about systemic risk. We need to understand the cascading and interconnected nature of risk. We need to avoid compartmentalized research and hazard by hazard risk assessment because that does not work. And we need to ensure that vulnerability aspects, the exposure aspects are highlighted in both research as well as risk management. We need to adopt a systemic approach which takes into account the human, the ecological, the ecosystem-based approaches. So here I will talk about the human ecological approaches in context of vulnerability. Next slide, please. So, and before I move forward, let me just also highlight the fact that the achievement of disaster risk reduction is a very paramount pillar to achieving the SDGs. Any development process that does not take risk into account cannot be sustainable. And you see that this was a huge opportunity for us, and we have ensured that many of the SDG indicators align with the Sendai indicators as they are monitored. In particular, SDGs 1, 11, and 13, some of the indicators are the same as those of the SFM, the Sendai Framework Monitoring Process. And the SDGs that you're seeing in blue here are fully aligned with the disaster risk reduction processes. Next slide, please. So one approach of addressing vulnerability is also to turn the inclusion process into agents of change. Next slide, please. So how do we do that? Essentially, let me give a bit of a background. So we assess each stakeholder group from the lens of their interest and their potential impact and influence on disaster risk reduction. And this becomes a very good basis to place them in one of the 4 quartiles that you're seeing on the graph. And our attempt always is to push them and work closely with them to ensure that they all reach the highest quartile, which is partnership. So how do we do that? Next slide, please. We have charted a scale of engagement. I often call it the ladder of engagement. So it all starts with knowing people like you. We are participating in meetings together, so we start knowing each other. If there is already an organized group of people, like-minded people, like organizations, that's the next step to start going from individuals to organizations. The second step is then we start ensuring that if there are networks of organizations that can come together so that the information exchange and can happen within that stakeholder community. We also ensure that these stakeholder communities also contribute to the regional and the global disaster risk reduction plans, like the Asia Pacific Action Plan on Disaster Risk Reduction. We have the global platform that happens every year, and I'll come to all of these in a few slides. One key criteria of success of dealing and engaging with the stakeholders is that we want all of them to become self-sustainable with minimal financial and technical support from UNDRR. And we have seen very high degree of success. This is something which I'll talk about it. And finally, for us, the highest parameter of success is programmatic collaboration. Can we do joint projects? Can we engage with the stakeholders to ensure that it's not just DRR is not just an issue of the government or of UNDRR, but it is a multi-stakeholder issue and all of us engage in that. This essentially means that we go on from an organization-specific engagement to ensuring that within that network of organizations, there is enough coordination. And then at a certain time, which is an ideal scale to be, that we ensure stakeholder-to-stakeholder coordination. Again, this is something which I'll touch on in the later part of my presentation. Next slide, please. So what we have done, this is where we are in Asia Pacific. Just to give an example, we have identified a series of stakeholder groups in the region, starting from science, technology, civil society, gender and women, and so on. And you will see that for each of these stakeholder groups, there is a network that is working on it. It's for the science and technology, the Asia Pacific Science Technology Academia Advisory Group. Takako-san is a very active member there. We have the Asian Disaster Risk Reduction and Response Network for the civil society group. The gender stakeholder group takes care of gender and women stakeholder. We have MGCY for children and youth, and so on. So you will see that we have already reached a stage where for each of the stakeholder group, there is an organized network of like-minded people and organizations who are working in close collaboration with each other. And our role is just as a catalyst. And all of you are scientists. When I say catalyst, I am using the definition of the chemistry definition of catalyst. We catalyze the process, but we don't take part in it because they have all become self-sustained. Next slide, please. Let me take a few examples from the 10 or 12 that I presented in the previous slide. Let me start with the Women and Gender Stakeholder Group. The Gender Stakeholder Group is one of the most active stakeholder groups that we have in the region. They're very actively working on strengthening the data ecosystem, including sex, age, and disability disaggregated data, and promoting gender-sensitive and responsive DRR actions. Recently, they have come out with a series of knowledge products and policy briefs that you are seeing on the slide. They're all available online. We are launching a very innovative program on Women International Network on DRR. It was announced yesterday. It is in partnership with the Australian government, and very soon at the Asia Pacific Ministerial Conference that will be hosted next year, we will launch this WIN-DRR program that promotes women leadership in disaster risk reduction. Similarly, we have launched in partnership with UN Women and the Red Cross, a gender inequality of risk program. Another very good example of joint programming, which is currently being piloted in the Pacific, and we hope to scale it up in other parts of the world and the region. Next slide, please. Children and youth, another very active, and we don't want to talk about stakeholder group without talking about the youth mobilization that we have catalyzed. We have come out with a series of publications with them. The Guardians of the Planet is a very innovative report. Thousands of children and youth have contributed to it. It was released 2 weeks back. They focus on evidence-based advocacy and a very starking mix of activism and content. You Inspire is a very, it's actually coming from Indonesia, a very good network of young scientists and professionals doing some very innovative work, and already now have their presence in 10 or 12 countries in Asia Pacific with a regional alliance. Next slide, please. And finally, perhaps something which, next slide, please, that this group will associate with, the Science and Technology Group. As the slide changes, this is one of the most active groups that we have. Takako-san has already shown some of the global products. Previous slide, I think we skipped 2 slides. Some of the global products from the science and tech community. We have also organized several conferences. Can we go to the previous slide? I think that was missed. Yes, that's the Science and Tech Group. These are some of the key products that we have released recently. The last 2, you're seeing the status of science and tech in the DRR in Asia Pacific, and the NATEC framework are being launched tomorrow. We have the 3rd Asia Pacific Science and Tech Conference being hosted by the government of Malaysia tomorrow virtually. So you see, again, they're a very self-sustained group of networks and individuals who are doing some fabulous job across different countries. Next slide, please. And that will be my final slide. That we want to reach a stage where each stakeholder collaborates with other stakeholders to produce the right policy framework and implement disaster risk reduction in a very inclusive way. We organize regional conferences and global conferences to ensure they come together. But then we don't end there. We have also launched a couple of years back what we call as a voluntary commitment, where people can register their commitments and ensure that they are implemented. This provides a very good mechanism for people to come together. And in context of COVID-19, we have partnered with science and tech community and children and youth to launch a series of toolkits for business, for integrating biological hazards and so on. So those are some of the products. And with that, I end my presentation. Thank you very much.
Thank you, Dr. Kumar, for your presentations. There are already several questions for you. The first question is from Rodolfo Arias. The question is like this. Is the UNDRR supporting efforts to prevent the transmission of zoonotic diseases, one of which could have triggered COVID-19? That's a question from Mr. Rodolfo Arias. Maybe 2 questions I will raise. The second question from Mr. Mujibur Rahman Tontowi. Great presentations. I want to ask, is the people-centered early warning system based on the vulnerability of population at risk, or is it just a buzz of word? Yes, you may answer these 2 questions, yeah.
Yeah, very interesting questions, and thanks for that. Yes, on the zoonotic diseases, in particular, pandemics, for example, as Takako-san was mentioning earlier, the Sendai framework has expanded the scope of disaster risk reduction to also include the biological hazard. So we have recently launched, in partnership with the Science and Technology Group, actually in Asia Pacific, a very comprehensive guideline on this process, on how to integrate biological hazards into disaster risk reduction. There is a technical advisory document that has been done. And then what we have done is to also develop 2 guidelines. One is in context of integrating biological hazards into disaster risk reduction strategies. That should be launched very soon. And some time back, we have already launched a guideline on how to integrate biological hazards into the UN planning processes, like the cooperation frameworks at the country level. And these are the kind of guidelines and tools that are based on very intensive discussions and consultations with the national governments and local governments to ensure that we integrate them. Also, if some of you were present at the webinar we did yesterday on the occasion of the International Day, we presented the outputs of a study that we have recently conducted. We have reviewed the national DRR strategies of all the countries in Asia Pacific to see to what extent they are integrating biological hazards into their DRR strategies. And the findings were presented yesterday, and we will be compiling them into a publication that we are going to launch very soon. So yes, I mean, zoonotic disease is something which is there. We are also launching a study on ecosystem-based disaster risk reduction and the nature-based solutions, because we see that the interaction between human and ecosystem is often leading to many viruses, and that could be a norm of the future. On early warning system, completely true. No early warning system can speak to the people if it doesn't warn the people. It's not just about technology. Last year, we did a very comprehensive review of with BMKG and BNPB in Indonesia of the Palu tsunami, and we launched a report. And that report was precisely on this topic, that we need to go beyond technology of early warning system and look at the social aspects of the early warning system, so as to ensure that the last mile of early warning reaches the people. What we have seen, and that is not a fail, but a limitation on our part, that we have ensured that the information flows very quickly from the community level to the centralized system where the early warning is triggered, but the flow back of that information back to the community is not as fast as we want it to be. And that's a limitation that we are trying to fulfill as much as possible. We have recently launched a project called the Climate Risk and Early Warning System in partnership with the World Met Organization and the World Bank, which is being implemented in the Pacific and will shortly be implemented in Laos and Cambodia, that will look at the people-centered early warning system by multi-hazard approaches. Thank you.
Thank you, Dr. Kumar. I think I will deliver another 2 questions, and this will be the last questions because we have a very limited time. First question from Philip Angelo Pandan. The question like this: in trying to map out the hazard cause of medical risk, can we simply use population density as direct translation to that of using distance to fault lines in mapping out earthquake hazards? As a follow-up of this, should this medical risk hazard map differ on the transmission mode of the disease? I believe that the hazard map of HIV/AIDS in Africa should be different from COVID hazard map. That's a question from Mr. Philip Angelo Pandan. And then the second question is from Martin Gracia. Do you have any innovative suggestions on how to reduce income inequality, taking advantage of the recovery efforts by stakeholders after a natural disaster, specifically in places where access to decent education is not available for low-income households? Yes, Dr. Kumar, please.
Very interesting questions. And I think maybe we can sit with both of them over coffee or drinks too.
Yeah.
In the interest of time, very quickly, yes, the first question in context of the using density from Philip, very interesting point. It's actually being used because exposure is one of the key components of disaster risk. And ESCAP has recently done a very interesting study that they have gone to the Makaran fault line and superimposed fault lines over the average annual losses and the density of population to see how much is the level exposure, both of the people as well as of the infrastructure. The same can also apply to other disaster risks as well, because density is a very good indicator of exposure of the population. But that can work only if we superimpose the hazard over the exposed population. And that will show what is the caseload that we have in case that virus breaks out. Of course, every virus behaves differently. So HIV map will definitely be different from the COVID map. COVID map will have a much greater function of density, while HIV/AIDS will have no relation with density. So it all depends on the hazard we are talking about, but very interesting point, and it's also already being tried and more needs to be done. The second question from Martin Garcia, another interesting question. I would answer by question in terms of how reducing inequality can be done in a post-disaster risk era or post-disaster environment. The key mechanism to ensure that we raise the bar on inequality to make everybody as equitable as possible is to use social protection as the right instrument in any country context. And this has come very strongly in all the countries in the world, where each country has been using some form or the other of social protection mechanism to ensure that people do have some form of an income floor to fall back on in case the crisis strikes. We have seen in Philippines, for example, the social amelioration program being linked with the 4Ps program to ensure that people have the right approach. We have seen in Thailand, where I live, where the health hazards have been managed over time because of a very strong universal health approach, where everybody has access to the health system. Same goes for education. In many countries, education is a fundamental right. And unless we make it linked with the social protection mechanisms, we will not be able to address it. But there are two challenges, and I'll end with that, which the governments need to look at while addressing and using social protection mechanisms. The first is that the issue of targeting. The huge inclusion and exclusion errors in all the countries when it comes to social protection. So while targeting involves a lot of resources, one way of dealing with targeting is to make it universal so that everybody has access to it, and only people who don't need it will go out of it. So it becomes a bit more self-targeting. Universal basic income is a very good example of universalization. And the second challenge which we need to look at is the agility of social protection. As you pointed out, as soon as a disaster strikes, the caseload, the number of people who would want to get benefited will rise. And social protection mechanisms should be agile enough that they take care of these extra caseload. But that can happen only if the social protection has the right instruments in place so that they can rise up to the occasion. And this is done only through DRR instruments like early warning system. If we have the right early warning in place, the social protection mechanism has the enough leeway time to scale it up. We also need the right contingency plans in place so that they use those contingency plans in the case of a disaster. So universalization and the shock responsiveness of social protection programs are the key to ensure they work well in disaster context. Thank you very much.
Thank you so much, Dr. Kumar. Actually, we still have another one questions in the question and answer room, and also another question in the chatting room. If you have still some time, would you please open those two rooms and then typing your answer there so that all the participants may enjoy your response to the questions. Again, thank you so much, Dr. Kumar. Ladies and gentlemen, now let's proceed to the third speaker. We will have Dr. Alexander Hamilton with us. He has worked with the UNICRE since 2012 and is currently regional coordinator for Southeast Asia within the EU Chemical, Biological, Radiological, and Nuclear Risk Mitigation Centers of Excellence Initiative. His work supports partner countries to prevent, detect, and respond to CBRN risk, whether natural, accidental, or deliberate in origin, more effectively. He holds a Doctor of Philosophy from London School of Economics and Political Science, specializing in risk governance and biosecurity. He has published extensively on these subjects and is a regular contributor to international efforts dedicated to combating biological weapons. Dr. Alexander Hamilton, you have 15 minutes for your presentation.
Thank you very much. I'm just going to share my screen. Can you see my screen now?
Yes, we can see your screen.
Excellent. So thank you once again for the kind invitation to present at this very important and very timely webinar. And on behalf of the European Union CBRN Risk Mitigation Centers of Excellence Initiative, it's a delight. I'm delighted to be here with you this morning, which is evening my time And thank you so much for that. In my presentation, I will discuss how, at its foundation, the CBRN COE, from its structure to its methodology, is premised upon building and maintaining multi-stakeholder and interdisciplinary partnerships to address risks like COVID-19 that by their nature do not respect national borders or institutional domains of expertise. Indeed, from the central role played by partner countries, interministerial CBRN national teams, to the COE's commitment to working with regional and international organizations to address risks that are global, our initiative is built upon multi-stakeholder partnerships. So it is a real pleasure to have an opportunity to present on our initiative's work in Southeast Asia. The EU CBRN COE is now in its 10th year. It's a global initiative that seeks to mitigate chemical, biological, radiological, and nuclear, or CBRN risks in partner countries to the EU. The CBRN COE is funded by the European Union, and it is jointly implemented by the EU and UNICRI, my home institution. It is funded through the instrument contributing to stability and peace, the EU's main international cooperation instrument, supporting security initiatives and peace-building activities in partner countries. The initiative follows a voluntary and demand-driven approach, which places COE partner countries at the center. In practice, this means working with national stakeholders to identify country priorities, which in turn provide a basis for designing and delivering capacity-building projects that will help partner countries more effectively prevent, detect, and respond to CBRN emergencies, whether natural, accidental, or deliberate in origin. An all hazards approach means that the initiative is fundamentally multi-stakeholder at its foundation. We look at risks ranging from pandemics, including the current COVID-19 crisis, chemical and industrial accidents, and of course, CBRN terrorist threats. So we look at a range of contingencies. We look at natural, accidental, and criminal risks. We also work with countries to strengthen capabilities, looking at prevention, detection, preparedness, and response. And last but not least, our initiative is multi-stakeholder at the national, regional, and international level. And in this presentation, I hope to show you how we work collaboratively at each of those levels to mitigate CBRN risks. To understand how we function and how we support partner countries, it's important to have a sense of the overall anatomy of the CBRN COE. The CBRN COE consists of 61 current partner countries grouped around 8 regions, each facilitated by a regional secretariat. I am the regional coordinator for the Southeast Asia Regional Secretariat. I work alongside colleagues, including a head of secretariat nominated from the Philippines, and alongside an on-site technical assistance expert, Sabay Pugh, who is online with us today, who supports partner countries at the technical and expertise level. There are 10 countries in our region. You can see the flags of our countries on this screen. And if we dig down deeper, at each country, we have a CBRN national focal point, and around the CBRN national focal point, a multi-sectoral, multi-ministerial CBRN national team. And this is just an example of the kinds of institutions and ministries that could participate in a CBRN national team. You can have, of course, the Ministry of Foreign Affairs, Ministry of Interior, Customs, Ministry of Defense, police forces, and security forces. But not only is this a security and defense problem, we also have representation on CBRN national teams from Ministry of Education. Universities are critical to this discussion. And so it is heartening that today's webinar is being hosted by an institution, university, and bringing a level of awareness to this topic, which is by no means only a security and defense problem. It requires civil sector alongside the public sector. It requires an all of government and indeed an all of society approach. So CBR national teams are structured to reflect the different elements of society that need to work collectively to address CBRN risks. The CBR national team for each country is central to the initiative, is responsible for assessing national needs. This is done by developing national CBRN action plans, which identify priorities for capacity building for countries. These national action plans can then be shared with other countries in the region and can be used then as a basis for developing regional action plans, which can identify regional priorities for capacity building. And last but not least, the CBR national teams participate in tailored regional projects. And these projects can include trainings and tabletop exercises and real-time exercises, among many other projects and activities that can support capacity buildings in partner countries. Our cooperation, of course, extends beyond the national level. To effectively address risks which cut across national borders, we need to work at the regional and international level. And on this slide, we can have a sense of the different regional and international partners that work with us to share knowledge and to mitigate cross-cutting global risks. In my next slides, I'll be discussing in particular our response to COVID-19. And this is a problem, of course, that requires a One Health approach, requiring animal health, plant and environmental health. And also, if we add the security dimensions, we need to include the discussion from the security sector. So naturally, we have partners from the World Health Organization, the World Organization for Animal Health, the Food and Agriculture Organization of the United Nations, Interpol, and others who work collectively to address these risks, and we share knowledge and cooperate to ensure that we can be as effective as possible. So let's take a closer look at our COVID-19 response. The EU CBRN COE is contributing to the response against COVID-19 by activating its network. This means its regional secretariats, its national focal points, and their national teams, and by putting the achievements of COE projects, both past and ongoing, to the service of partner countries. We are also sharing the latest technical information and good practices on COVID-19 response with national focal points and the wider biological risk community in each region, in our case, Southeast Asia. The Regional Secretariat for Southeast Asia and national focal points from across the region have also specifically been working to share experiences, good practices, and lessons learned throughout the ongoing COVID-19 crisis. And in this slide, you see that we've particularly been active through a peer-to-peer webinar series dedicated to sharing knowledge and experience between partner countries. To date, we have run 10 webinars. These have been led by partner countries: Thailand, Cambodia, Singapore, Myanmar, Brunei Darussalam, Laos PDR, to name only a few. From our first webinar, which looked at success stories of a quarantine strategy, which was an experience from Thailand, to our second webinar, which was led by Cambodia and featured the Institut Pasteur of Cambodia, which was on the topic of using existing networks for future COVID-19 surveillance. We've had webinars led by Singapore and also in partnership with the WHO. We have had webinar on grassroots effort to combat COVID-19, looking at Myanmar's experience developing community fever clinics. Brunei Darussalam has shared knowledge and expertise on the development of a COVID-19 laboratory and the experience in translating that laboratory from building from its foundations to its success. We have also heard from Laos PDR and its experience in COVID-19 control and response. And as you can see on this slide, our next webinar will be on the 20th of October, and it will be led by Vietnam. And we welcome each of you to participate in that knowledge exchange event. Indeed, I could not be happier to participate in these kinds of knowledge exchange events as we are today, because in this new normal we're living in, this is our best opportunity to share knowledge, to learn from each other, and to strengthen each other's capabilities. And so this is one of the many activities that we are undertaking to support countries in the region. I'll conclude just by noting another key ongoing project that is very relevant to the ongoing COVID-19 crisis, and that is CBRN Project 81, BioSec, Enhancing Biosecurity in Southeast Asia. This project is working with partner countries to raise awareness on biosecurity, biosecurity risk management. It's looking at cross-cutting biological risks, including zoonotic diseases like our ongoing pandemic. It's also looking at dual use risks, so risks associated with advances in science and technology. And most recently, it has added a dedicated work package to support countries on developing surge capacity for not only COVID-19, but also future pandemics. Because we have to be conscious of the fact that, well, we can weather the storm of this crisis, there will be others. And so the more that we can learn from each other, the more that we can strengthen our national and regional capabilities, the more prepared we will be for the next crisis. With that, I thank you very much for the opportunity to participate in this extremely important event today. Thank you again to the organizers for the kind invitation, and to our speakers who have delivered absolutely extremely interesting and thought-provoking presentations, and to our many participants online. My name is Alexander Hamilton, the Regional Coordinator for Southeast Asia. You're welcome to reach out to me by email. And also, for more information on the CBRN COE, please visit the website and you can learn more about our initiative. Thank you very much, and I look forward to taking your questions.
Thank you, Dr. Hamilton, for your presentations. So now let's see the questions that already raised by the participants of this webinar. Okay, a question from Adiasa Wismawam. The AU CBRN COA has 61 partners divided into 8 classes, with the exception of East Asian countries, i.e. China, North Korea, and Japan. Is there a possibility for the EU CBRN to work together in the future? As we know, these countries have a high potential CBRN disaster that can have an impact on stability and security in the region. Dr. Hamilton, you have the questions.
Well, thank you very much. Currently, our 8 regional secretariats, and I know I moved over the slide quite quickly, include countries in the Middle East and also Gulf Cooperation Council countries. Those are 2 separate regions. We also have the region of North Africa and Sahel, the African Atlantic facade, which includes much of West Africa, French-speaking Africa, plus Morocco, and also 2 English-speaking countries. Eastern and Central Africa, which is much of English-speaking East Africa, with the regional secretariat in Kenya, Nairobi, and Southeastern Eastern Europe and Central Asia, and of course, my region, Southeast Asia, which includes all 10 ASEAN countries. So those are our current regional secretariats. And given that the initiative is entirely demand-driven and from the bottom up, I can't speak to the future of new countries joining the initiative, or certainly new regions being added. I can really only speak to, at present, the existing regional secretariats, 8 in total, and the 61 partner countries. But thank you very much for the question.
Okay, thank you, Dr. Hamilton. I don't see another questions to you. So, dear participants, if you have still questions for Dr. Hamilton, you can drop your questions in the question and answer function. And don't forget to fill in the link for your presence in this webinar, so that later on you can get also the certificate of attendance of the webinar. Okay, so far there is no more questions about for Dr. Hamilton. So I think, okay, one question for Gerardo Castaneda Garza. I would like to know if training strategies, for example, seminars, workshop, simulation, and others, are being considered in the program.
Oh, absolutely. To every project, and to date, there have been 82 projects funded across the 8 regions in the 10 years of the COE's initiative. And so each of these projects, including 27 projects to date in Southeast Asia, each of these projects will include a variety of individual work packages, which will include elements including awareness raising for senior decision makers, trainings for frontline workers and technical experts representing the CBR national team. As we've touched on, tabletop and simulation exercises, also real-time exercises, including cross-border threats. So each project, based on the needs of partner countries and the region as a whole, will incorporate a variety of training modalities to ensure that ultimately, at the end of the project, that the legacy is that you've established a training system that has been built through train the trainer modules and activities. So indeed, there are, each project will include those elements. I hope that answers your question.
Okay. I see from the attendance, Sayaka Kobayashi is raising her hands. Is it possible for her to deliver her questions? I'm asking to the committee, to the organizing committee, or we just allow the attendees to write the questions in the question and answer function? It's not possible to ask, to provide her opportunity to deliver directly the question?
Yes, Ibu, please.
Bisa?
Yeah.
Saya ke Kobayashi. Can we allow? Okay. Okay, Sayaka.
Okay, Sayaka, please, your question you can ask right
now. Sayaka Kobayashi, Kobayashi-san. You are not allowed to deliver a question directly. There is no response from Kobayashi-san. Okay. Okay, then.
Hello.
Okay.
Yeah. Sorry, this is. I had to send my question through Sayaka's name. I'm Takako, one of the speakers.
Oh, okay, Izumi-sensei.
But I cannot send my questions through my platform because I'm one of the presenters. So I just borrowed her platform. So I hope it's okay to raise a question. You know, I spoke about the need and importance of working together from the natural hazard side and also the CBRNE, because I thought it's sort of the all hazards approach. So, I just would like to have your advice and on that effort, how we can combine and work together from natural hazard side and also the CBRNE side towards achieving the all hazards approach. Thank you.
Well, thank you very much.
Dr. Hamilton, let me deliver one more questions
yes.
From Rodolfo Arias. The question is, what are international cooperation efforts with regards transport security, particularly with regards shipment of containers across international borders, which could be used as vehicles for man-made hazards such as explosives or biological weapons? Now you have 2 questions.
Thank you very much. Let me first address the question of the, and thank you very much for that question. I think it's a very good one. My view is that it's extremely important to look at this topic holistically. So to look at, try not to make too many distinctions at the level of our strategies, from natural, accidental, and deliberate, we should be looking across that spectrum, because it is a spectrum, and biology and biological risk being my area of specialization, is a great example. You've probably seen illustrations of this spectrum of biological risks, and on one side you have naturally occurring epidemics and pandemics like the ongoing COVID-19 crisis. In the middle, you have something like laboratory accidents and incidents. So aspects of negligence can also fit into the middle of the spectrum. And on the extreme, of course, you have the possibility of deliberate events, including bioterrorism. And ultimately, the impacts of those events will be very similar. And many of the response mechanisms will be very similar. So there comes a point where it's no longer beneficial to compartmentalize each of these subjects, and we should be looking holistically. And I think that is something that's quite novel and refreshing in the CBR and COE initiative, is that we give scope for the possibility of a discussion on natural, accidental, and deliberate, and CBRN. We look at the full range of contingencies. That being said, and I'm sure you're highly aware, there are distinctions to be made in terms of investigation and detection when it comes to, for example, a bioemergency. The role of law enforcement and their relationship with the health sector is going to be special and unique in the instance of a deliberate event. It won't be the same for a naturally occurring epidemic or pandemic, but there should be scope in our conversation to ensure that we cover the full spectrum. And so I think it's an excellent approach to be taking an all hazards, holistic view on these kinds of risks and threats. And I would be delighted also to coordinate with you and communicate offline to share some more of the technical elements of that discussion. But I hope that goes some way to addressing your question.
Okay, the second one.
So if I understand correctly, it was on the question of cross-border threats and transboundary movements of potentially hazardous goods and materials, if I'm not mistaken.
Yeah.
So that is an integral part of the discussion, not only in Southeast Asia, but in each of the COE regions. Difficulties with porous borders in some regions, difficulties with transboundary movements of people and goods and products and technologies is indeed a major issue. And the COE does have a project P2P dedicated to looking at these kinds of issues, which will involve, of course, the role of customs, police forces, health and agriculture sector, pharmaceuticals and medicines. So for more information on the ongoing project that does look at transboundary movements of these kinds of materials and the sorts of preventive and response measures that we can put in place, I can be delighted to, again, coordinate with you offline to share more information on that project.
Okay, thank you so much, Dr. Hamilton. I think we should stop the discussion about your presentation because the time is already over. Thank you so much. And also thank you to the participants who already deliver questions to Dr. Hamilton. Ladies and gentlemen, now we come to the last speaker. We will have with us Mr. Robert Eriando Tumangor. He is an NBC staff officer at Engineering Directorate, the Indonesian Army. He holds a chemical engineering degree and Master of Science in Strategic Studies from NTU in Singapore. He also holds a military rank as a major from 2010. Mr. Robert, you have 15 minutes for your presentation. Pak Robert masih di mute itu. Nah.
Oh, hello. Can you hear me? Yes.
Yeah.
Okay, thank you very much. So first of all, that I would like to extend my gratitude, especially our organization's gratitude to APRU for the invitation in this very timely webinar. Also of our roles and functions and our tasks in related to the CBRN disaster or emergency. And quite different with other presenters that now we are talking about from our responder side. It means that we are the people on the ground. So hopefully that our information or sharing information and lesson learned also can be got it together with and also plan and strategies. Next slide, please. Okay, so scope my presentation is about our NBC unit, and then the involvements in COVID-19 pandemic response, the challenge, and the last, the lesson learned that can be shared, especially for the NATA's disaster preparedness. Next slide, please. Okay. So this is our NBC unit. So it's since 1990. We call the name of the unit NBC Unit of Indonesian Army Engineers. And its main task, especially to provide support in CBRN protection. So as per the organizational chart that is coming from the Indonesian National Armed Forces HQ, then to Indonesian Army Engineers Corps HQ, and then go to the NBC unit. So this is a real field unit related to the NBC, to CBRN emergency response. Smallest unit is a platoon size. It consists of a recon team or CBRN recon team, decon team or decontamination team, and evacuation and disposal team. Next slide, please. Units equipments, especially for personal protective equipments, coming from the level hazmat level A, level B, or level C, impermeable and impermeable suits, and then with the CBRN recon equipments that we have like chemical detectors, radiation detectors, markings, samplings, and also our NBC recon vehicles. And then the decon solution and equipments. And the last is the evacuation and disposal equipment. Those of the equipments belong to this unit. Next slide, please. So how about the unit improvements in the COVID-19 pandemic response? First of all, this is especially in Indonesia. The first improvement in Natuna Islands quarantines related to the peoples from Wuhan, Indonesian people from Wuhan. They wanted to back to Indonesia, and as per the government policy, they have to be quarantined in Natuna Islands. 20 personnel being sent and joined with other teams in Natuna, and they deploy in 1st February 2020 from Halim Perdana Kusuma airports. And their tasks especially related to decontamination, personal decontamination, vehicle decontamination, and field decontaminations. And then infectious waste disposal using incinerator, and preparing and establishing zoning area and for controlling cross-contamination. And their durations of works there is 14 days. And after completed their mission there, and it's being checked, there's, thanks God, no personnel or NBC personnel being infected with the with the SARS-CoV-2 virus. Next slide, please. And after completed their mission in Natuna Islands, they come another order. They have to go to Sebaru Islands, conducting the same similar mission, quarantine, especially from the ship crew from remote and remote ships at the time. And they are 20 personnel from the NBC unit, and they deploy 26 February 2020, and similar with the previous mission in Natuna Islands. Their task is decontamination, infectious waste disposal, and then zoning area and controlling cross-contamination. Duration of the mission is similar also for 15 days. And at the end of their mission, they're being checked, and thanks God, again, no NBC personnel is being infected with the SARS-CoV-2 virus. Next slide, please. Okay. And again, that's the declaration made by the president that Indonesia now under the COVID-19 pandemic is a national disaster. So our NBC unit also being involved in this disaster operation mission, especially in Kemayoran, Jakarta, and Galang Hospital, COVID-19 hospitals. About 20 personnel of NBC unit being deployed on those two hospitals. They deploy since 23rd March 2020 up to date. So those mission on those hospitals, there's already for almost like 6 months. And their task is still similar with decontaminations, infectious waste disposals, establish zoning area, and controlling cross-contamination on those facilities. And duration of the mission per personnel is is personnel being rotated for 2 months. And thanks God, after 3 rotations being conducted, so far there is no NBC personnel is being infected with the SARS-CoV-2 virus. Next slide, please. So what is that we can share as a challenge to our unit as the local responder or as the first responder or on the people on the grounds? First of all, that we understand that Indonesia is archipelagic islands. We are being distributed. We have many islands, and it's being put quite far away from one island to another islands. And the rapid mobilization mostly we need with the aircraft. So equipment dimension of our NBC equipment still another challenge in order to be loaded to those aircraft, especially with the C-130 aircraft. The challenge is the changing informations related to the hazardous characteristic of the SARS-CoV virus versus the protection guidance and also for infection control. So this is another challenge for us also. And the third challenge is responder PPE standards or personal protective equipment standards versus their duration working hours. So this is another challenge that we understand that if we are wearing those PPEs with the hazmat PPE made from the impermeable suits, you will face about the dehydration challenge. The next challenge is reliability and availability with detection means versus finding infected individual or infection spreader among the people. So again, this is a very, very tough challenge, especially at the beginning of the missions. Next slide, please. Next slide, please. Yeah. Another challenge is disinfection hazard versus micro droplets and pomades contain SARS-CoV. Back again, please. Yeah. Another is about the disinfection hazard and versus micro droplets and pomade contain SARS-CoV in public spaces. It is very important to be conducted, but also guidance made by other institutions. They also they banned this process, but we're still facing with these micro droplets and pomades content with SARS-CoV-2 in public spaces. So there's another challenge. The next is about the limited implementation of hazard area zoning system for handling infected, contaminated target or protecting facility. So among our responder also is not very familiar with this system or zoning system. So so this is another challenge also to control or handling infected, contaminated target or protecting facility. Last is about emergency situation, emergency call numbers. So this is another challenge also. Next slide, please. Next slide. Yeah. So what is the lesson learned? So that we can say about the lesson learned from our unit is epidemic and pandemic disaster. First of all, it could be like a health crisis, but now becomes a CBRN crisis because we now facing about a lot of waste. So we have to conduct disposal quite a lot of infectious waste also. And now the split of the infection among the people still another challenge. And how about for the natural disaster is, first of all, we like to think that this is first is a CBRN crisis, but at the end it can be also as a health crisis. And the priority of task is still like life saving is the priority, the top priority, but also including protection of people and community and environment from the hazard and its impacts. For the hazard protection, yes, it's very important to understand types of hazards and routes of exposures. And again, local responder is the main keys to contain the hazard and to minimize the impacts. And about the multi-agency response, the requirement, yes, we need a rapid, massive, and integrated response, interagency response. And it must be built on communication, cooperation, collaboration, command, and control. Especially on the locations, units interoperability is needed, and also their familiarity about the hazard area zoning system for contaminations and infection control. Next slide, please. So what we can recommend also, if you can say it's a recommendation or also it's a lesson learned, is for the natural disaster or CBRN incident preparedness. Yes, for the CBRN hazard prediction models we need, and also mapping resources. Again, single integrated emergency call numbers in order that we can speed up the process to provide the support or the help. And the standardization in CBRN equipments, techniques, and response procedures, especially related to the hazard early warning system and notification system, individual protective equipment, donning and doffing, detection and identification of the hazards, decontaminations, personnel, material, including like a transport system, transport means like a vehicle, ships, and airplanes. And then building decontamination of field decontamination. And then with the medical supports and treatments, and also including facilities. And then transportation and disposal of contaminated remains and hazardous and toxic waste. Again, availability of CBRN equipment and stockpiles. And then wider CBRN hazard awareness and training and exercise programs for different target audience. And the last is national, including government and non-government organization, regional, international, cooperation in research, also in training and education. So these are all that we can say as a recommendation for better preparedness. And as the closing, we can see part also is very important after this pandemic, or we're still facing this pandemic, COVID-19 pandemics, that to build a sufficient national capacity and capability for responding to NATEDs or CBRN disaster, you can say, will take times and require proper budget allocations and also enduring supports from all related stakeholders. However, failure to do so, those events can quickly overwhelm the infrastructure and capability of the responders and have potential to destabilize governments, create conditions that exacerbate the violence, even promote for the terrorists. So that's my end of presentation. Thank you very much. Now, I'm very happy and look forward to taking any question, please. If there is any question, I'm very happy.
Yeah. Thank you so much, Mr. Robert, for your nice presentation. This is a real experience, how we tackled with the disaster, in this case, relating with the COVID-19 pandemics in Indonesia. And then we have learned also how in tackling this pandemic, multi-stakeholders are involved in our country. For example, in this case, the army is involving themselves in facing the pandemic, the COVID-19 pandemics. Ladies and gentlemen, if you have any questions for Mr. Robert, please drop your question either in question and answer room or in chat room. So far, I try to find, okay. There is a question, Mr. Robert, from Ahmad Afif Mauludi. How about psychological hazard? Is there any issues related to stigma or negative view from people around the personnel after they back to their home or their base because working around COVID-19 infectious area? And is there is any, how to overcome the situation?
Yes, thank you very much. Indeed, it's very interesting question. Yes, about the physical hazard to the personnel itself. Yes, it's part our health system for especially for the troops coming back home from the mission area. It should be like there is a consultation, especially about their physical healthiness, and normally. They're being say it's okay. They check all the condition, their medical, like I mentioned from the previous slide, that before end of the mission, they will check whether they're being infected or not with the COVID-19, and SARS-CoV-2 virus. But also including it, they will be checked also about their healthy conditions and psychological conditions. And after they are back to their home, they will be given like some of the what you call it, holiday or rest in order to recover again with their mental health and also to meet where they are. So, and they bear their own medical personnel in their own unit. So it's okay. It's a part of the system. After back from the mission, yes, must be there is a consultation and for the checking for the fitness and also physical healthiness. Thank you very much.
Okay, thank you, Mr. Robert. There are still two questions. One question from Eric Oinde from the Philippine School of Business Administration. This is his questions. Following the recent Mount Sinabung eruptions, what are the strategies that were developed to ensure efficient and safe evacuation of the residents, bearing in mind that social distancing is one of the key to preventing the spread of COVID-19? That's the first question from Philippines. And then the second question from Mr. Adiasa Wismawan. The Indonesian president said at the UN General Assembly that no one is safe until everybody is, which means that we could come along to deal with this COVID-19 pandemic. Is there any military cooperation between Indonesia and another country to deal with this issue? Those are the two questions, Mr. Robert.
Okay. The first, thank you very much. Those are very interesting and very tough questions. Yes. About the evacuations and during the Sinabung mountain eruptions, during the pandemic, the COVID-19. So tell you the truth, this is not only the disaster happenings in Indonesia. There is another also related to the floods and landslide. Even last week, there is a landslide also in Jakarta area during this pandemic COVID-19. So about the introductions or the guidance for social distancing, especially related when you conduct the evacuation of the people. Again, we need all cooperation from all related stakeholders to implement those guidance in order to protect all the people, protect everybody to being infected by the SARS-CoV-2 virus. Yes, about the strategy itself is we follow the similar guidance for the social distancing and also wearing masks and then washing your hand, and also from the medical personnel also they conduct about like testing and tracing and also treatment of this infected. The most important thing, what is the most hazard that we're facing there is the volcano eruption. Yes, so people must be evacuated, and those guidance for the COVID-19, for the health protocol, it also must be implemented. It's not so easy, but it must be done. People must understand about this. And not only with the local people, but also all related stakeholders. Again, this is a huge challenge. But anyhow, thank you very much. That's a very interesting question, and I think we are facing this almost a similar issue right now about facing the similar another disaster during this COVID-19 pandemic. Thank you. So what is the next question? The second question?
The second question is there any military cooperation between Indonesia and another country to deal with the COVID-19 pandemic issue?
So, so far as I know, there is no military cooperation to conduct the COVID-19 pandemic response directly. But yes, we need every support from other countries, especially related to when we evacuate people from Wuhan, China at the time. We evacuate Indonesian people from Wuhan, China. Yes, our military must cooperate also with with the local countries, not only one country but another country, because we drop several military, so we need to inform another country. So it means that the cooperation is like providing permission to land with our plans on the airport, and also to got some of the support from those questions. Remember, there is another coming that the Indonesian bought a lot of medical supplies also from other country, and by using this military aircraft. So yes, it's not a direct like a military and military cooperation, but mostly with supporting each other during the pandemic, to respond to this pandemic 19 disaster. Thank you.
Thank you. I will deliver another 2 questions, and this will be the last questions. The first question is from Mr. Muhammad Abduh. How is to dispose all hazardous material after decontamination process? How to dispose all hazardous material after decontamination process? That's one question. Another question is from Professor Sabarinah Prasetyo, the Dean of the Faculty of Public Health, Universitas Indonesia. Based on your experience, in your perspective, how is the local cultural factors influencing the public health measures for COVID-19? For example, using face mask, hand washing with soap, and restriction to mass gathering. How did your team face this kind of challenge? Those are the last 2 questions, Mr. Robert.
Okay, thank you very much for the question. It's very interesting questions. Yeah, we are dealing with the decontamination and the waste. Yes, for sure. During the decontamination, mostly our decon solution using water. It means like a water-based decon solution. And related to the COVID-19, the challenge is the biological agents. So when this is also similar with other, or is a similar type with the disinfectant types. So when being this decon solution apply to those contaminated materials, it will work similar with the disinfectants, with other disinfectants. But the challenge is about how those disinfectants will when it goes to the environment, whether it's become like to pollute the environment or not. And again, according to the military, we use the standard military decontamination solution that is being produced already fulfill the international standard. If they being used, it can be disposed or being drained out, goes directly to the environment. So it's okay about those disinfectants that being used as per our military standard or as per NBC unit standards. And other about the waste, like solid waste, we'll follow the guidelines from our Ministry of Environmentals that we use incinerators to dispose all these solid waste, especially with the infectious waste. So I think that's my answer about for the question, the decontamination and the waste issue. The second question is again, what is about the experience?
How your team dealing with local cultural factors that influence intervention or implementation of health protocol relating with COVID-19 pandemic.
Yes, thank you very much for the local culture. Yeah, when we are going to implement this health protocols with the COVID-19 health protocol. Again, we are the Indonesian, we wish that everybody will support one to another. All the related stakeholders, we have to understand that the Indonesians still with the under pandemic, COVID-19 pandemic situations. So in every culture, we try to, again, about wearing mask or no mask at the beginning, yes, there is people say it's not good, but other people say from the local people, yes, we need to wear masks. So again, about the local culture itself, is quite not so very a big pushback or a big challenge from them, but how to wear those masks in everyday life is still another challenge. It means that how long that do you want to wear your mask, even in your home or something like that, or even in among your family or not. So those the challenge that being faced when we try to socialize this health protocol, especially among in close relationship or in one family. But when you meet with another people, with the different people from coming different city or you don't know who as the people will go directly, or when we say that please wear your mask, yes, they will do that directly. But among themselves, among in the same family, that's another challenge. Again, probably this is our culture as Indonesian. We are family, and if we know each other, probably that it's not so easy to ask them to wear or have to put mask about like 1 hour, 2 hour. Yes, again, it's another challenge. Thank you.
Okay, thank you very much, Mr. Robert. It's very useful to see your team real experience in the situations. Very good insight for all of us how this sectoral cooperation is really important in dealing with disasters. Ladies and gentlemen, we have learned during this webinar that the hazard that causing disasters can be biologically, chemically, physically. And it's also happen naturally, or it happens due to industrial incidents or another man-made causes. So disaster risk reductions efforts require strong collaborations and partnerships among various stakeholders at different levels. Further involvement of a broader range of experts is necessary as more disaster risk types need to be addressed. This session invites speakers from international regional organizations, governments, academia, and then this session already all the speakers affirms that multi-sectoral collaboration, multidiscipline collaboration is a must for us to deal with disaster, especially to reduce the risk of the disaster. I think this is all the conclusion of our webinar this morning. Again, I would like to deliver my deepest thanks to all the speakers, to Professor Takako Izumi, Dr. Animes Kumar, Dr. Mr. Robert Arianto Tumanggur. Thank you so much for your valuable presentations. We really enjoy your presentations, and we have a very great discussion during this webinar. Thank you so much also to all participants for your participations, your questions, your insights, so that we have learned many things from this webinar. I think this is all for today, and then by saying thank to our God Almighty, Alhamdulillahirabbil alamin, of this seminar, and may all of us can learn more and then give better for our society. Thank you.
Thank you very much, everyone.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you so much, Alexander.
Thank you very much. Thank you.
Thank
Thanks
you,
for
Dr.
invitation.
Kumar.
Okay.
Thank you,
Bye-bye.
Dr. Animes. Yeah, thank you, Pak Robert. Thank you,
Thank you, Bu
Dr.
Padma.
Alexander.
Ya, terima kasih.
Thank
Thank
you, Dr.
Thank you, Prof.
Kita Kako. See you again. Bye-bye.
Pak Robert, terima kasih banyak.
Yuk, sama-sama. Terima kasih
banyak,
semuanya.
Bu.
Terima kasih
banyak, Bu
Bu
Agustin.
Pak Robert.
Pak Abdul,
Thank you
Bu
very
Debbie,
much.
terima kasih ya.
Terima kasih. Jangan lupa isi daftar absen. Thank you.
Live, Dik.